Hi everyone. Finally, I'm making this video on medical interviews. I have got a lot of questions about how to approach the interviews. So today we will do a very brief guidance about how to answer which questions they ask and how to answer these questions. So just let's go to the point. I love this book, Medical Interviews. This is based in the NHS, in the UK, in the NHS, and it's an amazing book on how to approach medical interviews. I will post in a link below in the descriptions. If you read the description of this video, there will be a link for a PDF to the second edition. This is the third edition. If you can buy it from I think it's in Amazon. That would be great. If you cannot buy it, just have the second edition. So this is the second edition of this book. So introduction to structure of an interview, selection criteria, making a scheme, key interview questions, and it's really, really good. It has how to manage difficult colleague and other issues, communication station. Very good book for a reading. And then this website from Advanced Med. So it also has very good insight about what questions you get asked and how to answer them as well. So these are the two things that, that's the two things that you should be aware of. And so I will put both the PDF and the link in the job descriptions. But before you start preparing yourself, I want to give you a brief summary. What do they ask in the interview? So the interview is a 15-20 minutes meeting call. You got some personal questions. So the common one is tell us about yourself, walk us through your CV. Why do you want to work in this hospital? And tell us about your strengths and weaknesses. Then you get a clinical scenario. So in any clinical scenario, you will always prioritize that the patient is stable, do an ABCD assessment and escalate the case. That's the main thing they look for a junior doctor to do. And then you got behavioral and conflicts questions where I will explain the mnemonic that we will use. So let's go one by one and go a little bit more in detail for each one of these. So for the personal question, tell us about your CV and walk us through your CV. So there are two ways to do this question. You either use the CAMP structure, which means you talk about your clinical experience, then your academic, then your management, which includes research and teaching, and then your personal life. So, and then you can also do it in a chronological order where you do some emphasis in the milestones. So I would say I did graduate med school in 2023, and then I did my internship in Spain. And during my internship, I came to Australia. I did a medical elective where I learned how the Australian care system works. And then I prepared for IMC1. I passed it my first attempt, and then I got a job, and now I'm working at the Royal Harvard Hospital. So that would be the chronological order. But if you want to do it on the camp structure, so from the clinical point of view, I'm working now as a resident in this hospital in Spain. From the academic point of view, I have graduated from in 2023, and for the management point of view, I've been involved in some research, and I'm also involved in some teaching where I teach other junior doctors about safety management and whatever topic you teach. And from the personal point of view, people see me as an active person and someone always willing to learn. So that would be two ways to answer this question. Very important that you never go to an interview without preparing. You should have a document. Everything should be prepared in this journey, right? You should have a Word document where you configure your answer and you write your answer, how you are going to present this question. You memorize how you're going to say it, and you say it like this in the exam. Under the stress of you say it in the interview. Under the stress of the interview, it's very easy to start, confusing things and do not have a structure. So please do this. And then, why do you want to work in this hospital? This is a question that gets asked a lot. So you have to, very, very important that you have to read about the hospital. You need to know what's the hospital, where is the hospital, what are the teaching in the hospital, what are the training opportunities in the hospital, what are the values of the hospital. And that's what you have to say. And you need to have that prepared. So you would say, most of the common reasons is supportive environment. So I have read posts or I have talked to people who have worked previously in this hospital, and they have always praised the supportive environment and how the consultants are very friendly and very supportive to their juniors. I'm aware that this hospital has emergency medicine training, or I'm aware that it has a surgical training that I'm willing to involved in once I get my general registration. I also heard that the hospital, and I also read in the website that the hospital has a weekly teaching sessions, which I'm really interested in, which I really think they are important in developing myself as a physician or as a doctor. And then I have friends living around, or I live nearby the area, or I have visited the area, so I'm aware of the area, and I think that would be a very good area to live with and settle for my future. And then you can also, sorry, I will add one as well, long-term plans. So it's always nice to say that this hospital or this location fits my long-term plans in living in Australia and living in this area, because I want to live there for 5, 6 years, and I want to do my training there. So always link it to your long-term plans. Perfect. So that will be 2 questions that should be prepared always before. And then the other question is, tell us about your strengths and weaknesses. So you have to give real examples. So for communication skills, like I'm someone who has been always praised for their communication skills. I always make sure that my seniors and my juniors and also the nurses are aware of the plan, and I will always communicate effectively with them. Even with the patients, I try to simplify the medical diagnoses, and I try to talk to them with empathy and listen to them, and then have an open conversation about what are the expectation and what are the plan from the medical point of view. That's how you justify your communication skills. And then you give an example if you want. One day we had a difficult patient that was not able to understand our approach of management. So I took the patient to a quiet room, calm environment, and I explained to her that her condition cannot be treated in one day, and we need to do other testing. You give it the name of the conditions, wherever, or you make any other type of communication skills. We had a patient who was diagnosed with pancreatitis, and then he had multi-organ damage and multi-organ failure. So I had to communicate effectively with a lot of subspecialties, and I had to call cardiology, I had to call general surgery, I had to call as well gastro, wherever. So you involve, how did you show that? Another strength could be interpersonal skills. So I'm someone who is always able to manage situations where interpersonal skills are needed. So I always show respect, and I'm always kind in my interaction to all the medical stuff and also all the other allied health stuff. And that helps in making the environment of work, a bit more dynamic and a more pleasant place to work. And you give an example, time management. So I also am very good at time management. So I always have a plan of how I will manage my shifts. So I start with high acuity patients, and then I do move to discharge patients who need to go home that day. So make sure that discharge is done before afternoon time, so we can book the transport. And then at the end, I do the less urgent and the less important task, and I also delegate my tasks to my juniors. So this is how we manage time. Even in my personal life, I do manage time by having a proper schedule and allocating 1 hour 2 hours to this thing, and then 1 hour to other to these things. So that would be some strength to manage. You can describe it as much as you want. You can give examples as well. One day we had a hectic shift, and it was because of my time management that we could make it, and you give a specific example. So just feel free to give all the examples you want. And then weaknesses, show some weakness that will not show you that you are so bad. And then start from there, and then show how you're working on improving that weakness. So sometimes I take a lot of work on myself and I feel overworked, and one of my weaknesses is I have to learn where my limits are, and I'm trying to improve that and always seek help when it's needed, so I'm not overworked or I'm not burned out, something like that. So that will be some questions that you have to think about prior to the interview and prepare for them, okay? And after the personal questions, we will move on to the clinical scenario. So you will always get a clinical scenario: chest pain, shortness of breath, reduced level of consciousness, abdominal pain, sepsis. You always have to say, I'm aware that this is an acute situation and I have to assess immediately the patient. You always assess ABCD assessment. The best website for ABCD assessment is Geeky Medics. So just go through this and read everything about it and make your own notes about how would you go for an ABCD assessment. Make sure the patient airway is patent, breathing fine. If needed, do oxygen, check the heart rate, the blood pressure, his febrile, the glucose level, and also the exposure. And collaborating, doing whatever you can. So if you can start investigation, start them. If you can start investigations, do them. If you can start management, do it. And always escalate to a senior or to your registrar or consultant if he's not aware. So that would be your assessment for the clinical scenarios. And this is need practice. So you need to write your chest pain assessment. You need to write your reduced level of consciousness assessment. You need to write your shortness of breath assessment, abdominal pain and sepsis. They will ask you some differentials. So that is part of the medical knowledge that you have. It's not something that I can explain in the video in detail. So you can use ChatGPT to help you a little bit on how to answer these clinical scenarios and which differentials you will need to be aware of and what's your immediate management. They don't want you to do an extensive management. You have just to have the immediate management where you stabilize the patient, you make sure the oxygen is on, the fluids are running, and you start doing your quick assessments. Yeah. And then you get some behavioral and conflict questions. So for example, tell us about a mistake you made and what you have done about it. Tell us a critical remark that you have received from a senior and what you have done about it. Tell us a situation where you disagreed with your seniors and how did you manage that, and your colleague is coming late every day. Is coming late to work, how you manage. So the thing is, there is a mnemonic that I love, which is SPIES. So you always seek information, what's going on. You try to have open conversation. You have to have more information about the issue. Then first thing is to ensure patient safety. So always ensure patient safety. Make sure the patient is safe. Show initiative in showing what could you be doing and what could be done to solve any of these issues. If that's beyond you, or if you have already showed initiative and tried to solve the issue but it's not getting solved, you will escalate to a senior, and after the escalation you will always show support. These questions are very, very well explained in this book. They give you examples how you really have to say them. So that's something that you also have to prepare and you have ready. When I did my first interview, I actually had a Word document with 30 pages where I prepared each and single questions. And I think you have to make that effort. You have to prepare those questions yourself. So once you go to the interview, they are your own questions and you know what you're going to say. But it's not something that it's done in one day. It took me a week or 2 weeks to prepare them and learn them and, make them better. So take your time, but have a structured approach. Know what are you going to say. Don't go to the interview without knowing what are you going to say, and try to cover as many questions as possible. And that's for my video. So what I want to say is I will put these documents as well there in the link. So you will have the PDF and you will have this link as well, and the Geeky Medics link. So I will put these 3 things. And then the other thing, give me a second. I will also show you that if you are proactive, you can actually find this one as well. Let me show you. Where is it? So remember in my last video, I was talking about a group called Pakistani Doctors in Australia. So you definitely, if you go to this group and you go to the file section, and then you write interview, you have a lot of notes and PDFs and documents with interview questions, and you can start getting used to these things, preparing for a perfect medical CV and interview, interviewing, succeeding an interview. And there are very good, interesting, documents here that can give you a lot of information. So conclusion is you have to be very, very well prepared for an interview. This is the basic scheme of an interview. It's always very similar. There is no other things about it. For a junior role, these are the basics that you have to know, and you have to be able to manage all these 3 categories of questions. And then you have to make your answers. Be prepared for your answers. Seek help from this book and from the link I have sent, and also ChatGPT can help you rephrase your answers, but just make you say it in a very, confident way, calm way, smile a lot in your interview, and everything will go fine. I hope that was clear and that was helpful. It's a very brief guide. It will take me hours and hours to go through everything and do all the clinical scenarios. But I think that's an initial guide to help you start at least your preparation. And see you in next videos. I may be doing a video about observerships and internship in Australia. I just need a bit of time, but I will get that soon. And if you are liking this type of videos, I'm very open to any suggestions on the comments to do any other type that you would like, or anything that you would want me to cover. Subscribe so you get my notifications whenever I post a video. And thank you so much.